we get to know each other on our shared journey to improve more lives in more ways, I thought it might be helpful to share a little bit more about myself and how I got here. All of us have our own connect to purpose. It reminds us why we are here and connects us to the reason we show up every day to make our hospitals a better place for our patients, families, communities, and each other. It can also inspire us when challenges seem particularly steep. My connect to purpose is both theological and personal. The theological foundation is that I believe we were built for a purpose and that human life is not just valuable, it is sacred. Consequently, there is value in anything we can do to enhance human life. The personal side involves my family and specifically my dad. It was my dad's health that strongly influenced the path of my career. He was diagnosed with type 1 diabetes when he was in his 20s. His disease was fairly advanced by the time I was born. He developed serious issues with his vision, had significant neuropathy and balance issues, among other complications. All of us encounter people who live full and rich lives despite poor health. You may be caring for someone like that today, but it was difficult for my dad. When I was in college, my dad started peritoneal dialysis. My mom administered this dialysis at home 3 times a day until he received a kidney transplant, which failed. I visited my dad every day in the hospital until 7 weeks later he passed away. Yet through that experience, I became comfortable in a hospital environment and learned to appreciate the extraordinary compassion and expertise of the many professionals who cared for not just my dad, but my entire family. The care we received made a lasting impact on me, so it's not surprising that I pursued a career in healthcare. I earned a bachelor's and master's degree in biomedical engineering, and after college, I became a clinical engineer. I worked with children with congenital birth defects, trying to bridge the functional gap with technology and therapy for 12 years. Eventually, I wanted to expand the scope of those I could impact and help with leadership, science, and health services, so I ventured down the path of hospital administration. Through my 20-plus years at HCA Healthcare and the opportunity to work alongside caring colleagues like you, I have been privileged to do just that. I have been married for over 3 decades with 4 grown children. Now, in addition to division president, I proudly wear the title of Grandpa. They don't actually call me Grandpa. My chosen grandfather name is in fact Hefe, but they didn't pronounce that correctly, so I have become Happy, and I'm good with it. Everything I do for them, for you, and for those we care for every day comes from my strong belief that human life is precious and sacred. Thank you for allowing me to share my story in the coming months. I hope that I'll have an opportunity to hear your stories as well, and I encourage you to connect to your purpose every day. There is no higher calling than to care for others, and I'm honored to work alongside you to live and share in our mission. Above all else, we are committed to the care and improvement of human life.